My name is Brieffies. I'm a veterinarian in Clermont, Central Queensland. So as a mobile vet, my main work is large animal work and consultancy. We do see a lot of cases of Pestivirus in the line of work I do. It is something that I deal with day to day while I'm out preg testing and seeing reproductive in performance. We tend to be testing for Pestivirus through a serology test. Generally speaking, you can spot it in a herd. You might see that through ill-thrifty weaners or ill-thrifty cattle in general. But by and large, Pestivirus sneaks through the herd, causing its effect undetected. And it's not detected until we actually take some samples and send them to the lab to confirm. In fact, I've seen cases of sale-ready bulls that come back from the lab as PI positive, and they look no different to their brothers ready to go to the sale, so it hides itself that well. The cost impacts of Pestivirus are quite varied, and essentially it's robbing you over and over and over again. Where it can hit you is through reduced conception rate in your cows. You also see abortions, you'll see malformed calves, PI animals, you're also getting immunosuppression going through that herd. And that essentially equates to, we have a lot of other diseases implicated with Pestivirus, for example, bovine respiratory disease, coccidiosis, warts, ink eye, there's a few others as well. But what that essentially means is, because of those setbacks in that animal's life, that animal doesn't hit its target weight at the time frame that you require. So what that means is, instead of selling a bullock at 2 years old, you might be selling him at 2.5 years old because he's growing less. Because of all those diseases, that immunosuppression is a massive factor in Pestivirus. I've definitely seen cases where Pestivirus has caused a big economic loss to a client. One example that springs to mind was a producer that was trying to rebuild their herd after a dry season. They went out and purchased some PTIC cows, brought them home, had Pestivirus running endemically in their own herd. The naive animals that they purchased, there was 30-35% losses in calves, abortions. Yeah, that was purely as a result of poor biosecurity. They didn't have their animal health declaration, and they hadn't actually done their homework as to what had been done, and had they have vaccinated with Pestigard, we probably wouldn't have had the problem. Pestigard is the gold standard, I think, in managing Pestivirus. So Pestigard's very easy to implement into your cattle health vaccination program. It's simple, 2 doses is the initial course, and that's 4 to 6 weeks apart, but you can stretch that second dose out to 6 months if that suits your management practices, and then an annual booster thereafter. So very easy to implement into your program, and what I would recommend is, if you're worried about it or concerned, talk to your local cattle vet, and they'll be able to give you advice on the best ways to integrate it into your vaccination protocol.